Hello, I am Dr. Vivek Murthy, and I serve as Surgeon General of the United States. When you think of the Surgeon General, your mind probably goes first to the warning label on the side of a cigarette carton. That's because for more than half a century, my office has led the effort to educate the public about the hazards that tobacco poses to individual health and to the health of our communities. But I know that educating the public about the dangers of tobacco is not enough. Conquering addiction is tough. It takes willpower and commitment. And it takes dedicated health professionals who are able, willing, and ready to help those who want to quit. So I welcome you to this tobacco cessation training program, and I thank you for joining us in the mission to make our country tobacco-free. You heard me correctly. I'm not just interested in getting tobacco out of our restaurants, airports, college campuses, offices, and other public spaces. I truly believe that there is no place for tobacco in the great American community we are building, except perhaps in a museum. We have known for decades how harmful tobacco is to our health. Smoking cigarettes is the leading cause of preventable death and disease in the United States. And still, an estimated 42 million adults continue to smoke. The good news is that more than 2/3 of them want to quit, and about half report having made a conscious effort to quit smoking in the previous year. While it is true that most of these attempts will end in relapse, we know that with assistance, people can successfully quit smoking. Clinicians of all disciplines can substantially improve a patient's ability to quit successfully. However, too few clinicians are equipped with the necessary knowledge and skill to effectively assist their patients, and even fewer routinely address tobacco use in their daily clinical practices. This tobacco cessation training program was created to transform the landscape of clinician education related to tobacco. It is a comprehensive program designed to equip health professional students and practicing clinicians with evidence-based strategies for assisting patients with tobacco cessation. The content you are about to view draws heavily from the U.S. Public Health Service Clinical Practice Guideline for treating tobacco use and dependence. It advocates for the delivery of tailored, evidence-based interventions. Once you complete this program, you will be able to apply evidence-based approaches for helping your patients become tobacco-free. I encourage you to make a commitment to addressing tobacco use at every patient encounter. It is imperative that all health providers, their staff, and the broader healthcare system identify and address tobacco use and exposure as an essential component of patient care. Working together, we can reduce the overall prevalence of tobacco use and the heavy burden it places on the nation's health by helping our patients achieve healthier, tobacco-free lifestyles. And if we do this right, I believe we can get to a tobacco-free America.